Hi, I'm Trish. I'm a local GP in Tauranga. Thank you for giving me this opportunity just to share some tips, some ideas about managing chronic fatigue. You can also use these tips for managing chronic illness. I just want to give you just a little bit of background. I've never had chronic fatigue, but I have had to cope with mental health issues, and my husband passed away from motor neuron disease, so I do understand some of the stresses and some of the issues that you guys have to face. And it is really difficult, so I don't want to try and teach you to suck eggs, but hopefully there might be something in this that you can take away. I just want to start with Mason Jury's Te Whare Tapa Whā. So the whole concept of well-being, and I think this is quite powerful. So you've got the roof, which is the taha wairoa, which is your spiritual. You've got the other part of the roof, which is taha hingora, which is your mental, emotional. The walls, which is your taha tinana, which is your physical, and taha whānau, which is your family. And the foundations, of course, is your taha whenua, which is your land, your roots. And that's looking at well-being in a holistic way. And the reality is, if any of these things is not great, then the house is not great. And so family, mental, emotional, spiritual, physical, and the land. And the hard thing with chronic fatigue syndrome, it actually impacts everything. So to manage chronic fatigue, we need to look at it in a holistic way. I also just want to also acknowledge Dr. Rosamund Bellings. Some of her material is in this talk, and I've greatly appreciated her input into my patients. I've been a GP for 20 years, and I've worked with quite a few patients with chronic fatigue, with varying degrees of severity, and it is a difficult time, but many of my patients over time have improved. Many of my patients over time have been able to go back to some sort of employment and do meaningful work. So I just really want to encourage you, there is hope. It is a journey, but let's face it, life is a journey. I just want to start with exercise. One of the hallmarks of chronic fatigue is that post-exercise fatigue. You exercise, then afterwards you feel absolutely exhausted. There has been some research with the recent Cochrane review which has shown that exercise does improve over time fatigue. One of the key things with exercise though is pacing. And that's so hard because with chronic fatigue, some days you feel great, some days not so good, and learning to pace yourself, learning not to push yourself, learning to exercise with feeling comfortable, so you've still got some reserves. And the hard thing with chronic fatigue is you take longer to recover. There's been a lot of research around chronic fatigue, and even at the mitochondrial level there is issues, and the mitochondria are the power source of the cells, and there's been a lot of research done by Warren Tate down in Otago, which makes exercise quite difficult, but exercise is a very important component to recovery. So the key is pacing. Also, with chronic fatigue, often people are so tired that they're spending a lot of the time lying down. So you may even need to exercise lying down. And sometimes people have quite a lot of blood pressure issues, and so you may need to exercise lying down. So sometimes you've got to think outside the box a little bit. I've got one patient who adores her cat, and her exercise is taking the cat just for a gentle walk around the garden. But she's getting outside, getting some vitamin D, and she's having a gentle walk with the cat for 10-15 minutes, and that is so important. One of the things a GP can be helpful with is there is something called a green prescription. And so that connects to, in different parts of the country, will probably work slightly differently, but here in Tauranga, connects to Sport BOP, and they can partner with you to help you with your exercise. So that's one thing that your GP can do. One of the things I found personally quite helpful is the concept of rest. And when we came out of that first lockdown, I must admit I sort of hit the wall a bit. I'd been at home with my kids for a couple of months and then just had to get back and going. I found it really difficult. And I read this book called A Sacred Rest. And so it talks about, there's actually 7 domains of rest: mental, emotional, physical, social, spiritual, sensory, and creative. And if you have deficits in any of these, even like a couple, you will feel tired. I have so many patients that come to me, they say, look, I feel tired, I want my iron checked. So we check their iron, check their thyroid, all those bloods, everything's fine. But then you get to talk to them and there's a whole lot of emotional stuff happening for them. They're overloading their sensory. They're having to deal with lots of noise. They're mentally, they're worrying, and so no wonder they're tired. And it's not just the physical. So certainly understanding a broader understanding of rest, I personally found very, very helpful. Also, Dr. Libby Weaver has a book called Exhausted to Energized, and that gives a more broader understanding of rest as well. And so the book that I found particularly helpful was called Sacred Rest by Dr. Sandra Dalton Smith. There is also a quiz that you can do called restquiz.com. So restquiz.com, and you can access that. You can just Google that and do a rest quiz, and it gives you an idea of actually where your deficits are. So again, just looking at that bigger picture of rest. Stress is huge. Stress is huge in chronic fatigue and any chronic illness. You're having to, particularly with chronic fatigue, you're having to deal with a lot of loss, a lot of grief. Some people aren't able to go back to their work. It impacts their family. They're not able to look after their kids as much as they used to. So dealing with stress is huge. And let's face it, we don't always deal with stress well, but we can improve how we deal with things. And one of the things is people can get very stuck, particularly stuck in their what I call stinking thinking. Stuck in their thinking, in their negativity, and sometimes they just don't know how to get out of it. And our thinking and our emotions are very closely linked. So sometimes we've got negative thinking, then it's going to drive negative emotions. And what's feeding your thinking and your negative emotions often is beliefs and values. And I think the hard thing, particularly with chronic fatigue, when some of the things are stripped away in your life, and for myself with my husband when he got MND, lots of things were stripped away. A lot of it comes down to those core beliefs and our values. It is difficult, but sometimes when we really look at what's important to us, it actually can make us stronger people. It can make us richer people. It's essential to acknowledge stress, our thinking, our emotions, our beliefs. And often we need support, and sometimes that needs to be professional support. You can definitely chat to your GP, and also in some of the different chronic fatigue organisations, they have access to counselling. So you can talk to your GP about what's available in your area. There's also an online cognitive behavioural therapy course called Just a Thought. I've found Dr. Caroline Leaf, some of her podcasts really very helpful, and some of her books. There's also a book by Russ Harris called The Happiness Trap, which gives amazing practical help with thinking, stuck thoughts and emotions. And I have found all those things actually personally quite helpful, and also I've had some patients who've also found them helpful. It's not easy to ask for support, and different people, that support will look different. And part of the process of recovery is getting the right support around us. So it's not an easy thing. So just want to think about how things work together. So particularly with any chronic illness, particularly with chronic fatigue, your adrenals, which is your whole stress response, and your hormones and your digestion all work together. For people with chronic fatigue, often they have a lot of digestion issues, often hormonal imbalance, and of course your adrenals, that's that whole stress response. Your adrenals actually produce less cortisol, so your recovery for any type of stress is lower. So all those things work together, and particularly supporting your adrenals is really important. And some herbal medicine can be very helpful for that. There's some very good herbs, withania. Yes, certainly talking to a medical herbalist can be very helpful, trying to help those adrenals, and just being aware that everything works together. One of the things we often forget about is breathing. It probably sounds a bit weird, but breathing is really important in how we cope with stress. If we start to breathe up here, like do thoracic breathing, if you can imagine, you know, in a fighting ring and people ready to fight and they're breathing up there, that's sending messages to your brain that you're in danger, your body has to protect itself, so you'll be in fight and flight. If we learn to breathe down here, in our diaphragm, and we breathe abdominally, that sends messages to our brain that everything's okay, and our brain and our body can click into rest and restore. So breathing actually is really important. I've had some patients tell me that just by changing their breathing reduces their anxiety and also just helps them with general energy. So you can certainly Google diaphragmatic breathing, and there's lots of stuff on the internet about breathing. And when I started with my journey with mental health, I had to actually change my breathing. I had to spend quite a bit of time actually learning to breathe abdominally. And even now, sometimes if I'm feeling stressed, a little bit anxious, I will slow down, I'll put my hand on my tummy, and I'll just make sure that I'm breathing properly. Because we don't need extra messages to our brain saying, you know, we're in danger. And that just hypes up that whole stress response. And one of the other crucial things is sleep. And often a sleep routine and a sleep program is essential for recovery. Often with chronic fatigue patients, their sleep is impacted, and many of them will some need some sort of medication. One of the medications that's often used is low-dose tricyclics, either amitriptyline or nortriptyline. Often these are used at very, very low doses, 10, 20 milligrams, and it helps with the different phases of your sleep cycle, particularly your stage 4 phase. And Dr. Rosamund Vellings is a great advocate for using tricyclics. So what happens is you go into that deep sleep, and that helps with restoring. And I have found that patients have found that really helpful. But your sleep hygiene, your sleep routine is really, really important. So you need to go to bed at the same time, you need to get up at the same time. What's really important is, particularly when you get up in that, you know, in the morning, spending some time outside, and that just helps to rebalance the melatonin. Sometimes melatonin can be helpful as well. Sometimes other medication like quetiapine can be helpful if those things aren't working. But definitely a sleep program is very, very important, and making sure that you've got a really, really good sleep routine. And sometimes that takes a lot of work, and you may need to work with your GP with that. There's lots of different supplements. So I just want to talk next about supplements and medication. There's lots of different supplements, and I have found that different things work for different people. Unfortunately, chronic fatigue it just affects different people differently. And what is really hard is people can spend a fortune on supplements, which makes things very, very difficult. But there are some things that can be helpful. 5-HTP can be helpful with mood. Evening primrose oil can be helpful with breast pain. Garlic is good antiviral, so certainly if people are having viruses, they can use some garlic. Sometimes with chronic fatigue patients, I've said, you know, often they have a lot of gastrointestinal symptoms, often nausea. So some ginger can be helpful, and that could really help people with nausea. Ginkgo can help with brain flow and concentration. With chronic gut issues, sometimes probiotics can also be helpful, and St John's wort can be sometimes helpful with mood as well. When you're using some of these supplements, sometimes talking with a medical herbalist can be helpful, trying to tailor things for you. With most supplements, you need to give them a really good try for at least 3 months, making sure they're at a good dosage, a therapeutic dosage. And if you feel after 3 months there's been no significant improvement, then sometimes just letting them go. But often with supplements, particularly herbal medicine, they'll often need to take them for a good 3 months. I personally have found different herbs quite helpful, particularly in times of stress and low mood. But unfortunately, one of the most difficult things with herbal medicine and supplements is the cost. Medications. There is a place for medications. Different things, again, suit different people. With chronic fatigue, often people can get depressed. Sometimes they don't. That depression can be misdiagnosed or undiagnosed. I do believe there is a place for antidepressants. Not everybody needs antidepressants. And the ones that are used probably the most often is SSRIs. Mirtazipine's also starting to be used a little bit more, and these are the antidepressants that Dr. Vallings often recommends. Sometimes it's worth trying for 3 months. Often I start at a low dose and build up, because often I find people with chronic fatigue are very sensitive, their system's very sensitive, and particularly they can have side effects. So often I start low and go slow. Pain also is a huge issue with some patients with chronic fatigue. It's really important to avoid opiates, with your codeine, your morphine, those sort of medications. You get pain sensitizing, they're pain sensitizing, so long term, short term is fine. Long term, they will actually make the pain worse. So looking at pain modulating medications like pregabalin or gabapentin, amitriptyline, they change the way the brain is processing the pain messages. And there is some issues sometimes around tolerance and people getting used to them. So you do need to be talking to your GP about them. But pain is huge, and when we're in pain, pain really fatigues us. So certainly trying to get on, a good on top of your pain is really important. And most areas have pain clinics. They're quite hard to get into, but your GP can help with that if things are really not going well with pain, because often you need, it's not just about pills, it's a multidisciplinary physios, OTs, so it's a wider picture with pain. And of course, when we're stressed or depressed, then that's going to make our pain worse. So it's often looking at a multi-system approach. With chronic fatigue, some people get POTS, which is the orthostatic hypotension. So you stand up and your blood pressure drops and you feel tired and you just want to sit down. So there is a medication called fludrocortisone, which helps to keep the pressure up in the blood vessels. So that can be helpful. And for some people with orthostatic hypertension, so when they stand up, they've just got to stand up slowly, they've got to really maintain their hydration. So not everybody necessarily needs fludrocortisone, but that can be helpful. And the other one was sometimes with you need medication is with sleep. And that may be just for a period of time. Just because you're going on some medication for sleep, that doesn't mean you necessarily have to be on that long term, but that can be quite helpful. And as I mentioned, one of the medications too that can be quite helpful is quetiapine. Now, quetiapine actually is an antipsychotic. Everybody sort of freaks out when you say that. Well, am I going mad? But use it very low doses. It can help relax people and then put them into a deep sleep. try not use that long term, but that can be helpful just to help with sleep, because if we're not sleeping, things get pretty difficult. So what can you do today? How can you help yourself today? One of the most important things is being kind to yourself. It's really hard when you have any chronic illness, but particularly with chronic fatigue, when you can't do things that you normally used to be able to do. There's a lot of frustration. There's a lot of anger too, and being kind to yourself is so important. That self-compassion is actually a therapy in itself. So the one thing you can start to do today is to be kinder to yourself. Sometimes we actually need to be a friend to ourselves. Sometimes we're better friends to other people than to ourselves. So start to be a friend to ourselves. Increase your water. Often people don't drink enough. We should be drinking at least 2.5 litres a day. So making sure you're keeping up your fluids. And often with chronic fatigue, with that whole blood pressure issue, having some salt, putting a pinch of salt in our water, sometimes having a salty snack can also just help to keep your blood pressure up. So making sure that the main fluid you drink is water, or some nutritious herbal teas. So definitely cutting down coffee, ideally cutting coffee out, because your caffeine, what it does is stimulates your adrenals, but it's not giving any input into your adrenals. So if you can, maximum 1 cup of coffee a day. Great if you don't have any coffee. The other thing is eating as much seasonal fruit and vegetables as you can. There is so much confusing, to be honest. I've just recently read a book that really confused me about some issues with cardiac diet. There are so many things about diet out there which is very confusing. One thing that people's not arguing about is vegetables. And the more vegetables you have in your diet, the more colour you have in your diet, the more things that look real, the more cooking from scratch you can do, the better. And adding, herbs and spices rather than artificial sauces and things like that. If it's got numbers, it's not food. And then working out for you whether, maybe you don't do so well on dairy or gluten, or maybe you do better on a vegetarian diet. I've got some patients who do better on a paleo diet. So I think we're all so different. Our genes are quite different. So then working out what works best for you. But I think the foundation has to be water-based, leafy vegetables. That has to be our foundation. And we can always improve on our diets. So just upping those veggies, and I find vegetables are expensive. And that's difficult. I have a veggie garden. I have actually a huge veggie garden, and I grow a lot of greens in my veggie garden: kale and spinach and broccoli. If you can, and even getting just bins, and if you don't have a big veggie garden, but even if you can just grow some of your greens. And often in the supermarket I'll buy frozen veg, because often they're frozen fresh and you don't have as much waste. So frozen veg is a great way also to make sure that you're getting, economically getting your vegetables. And I know it's a challenge, particularly with the cost. And sometimes I say to people, rather spend money on vegetables rather than supplements, because we absorb those nutrients a lot better, from the vegetables. So if you can up your veggies, see more greens on your plate. Maybe this spring, think about putting in a little bit of a veggie garden. Cutting out sugar. It's another thing nobody complains about. Sugar is toxic. And sugar's got no nutritional value. If you're eating a lot of sugary and refined products, actually it puts your immune system doesn't work as hard. Your immune system works a lot harder and is not as efficient. So and it's hard because sugar's in everything. But if we can reduce that sugar, and we've got to have a few treats. I must admit I have a couple of little squares of dark chocolate at night. But if we can reduce refined sugar, that's massive. Another real biggie is alcohol. And alcohol is a liver loader. And sometimes if it's an event, having half a glass of wine or a glass of wine with a meal, that's great. But if it's as a regular thing, it's a liver loader, and there's no actual nutritional value to alcohol. Makes us feel good at the time. And when people are drinking alcohol on a regular basis, their body's not going to cope as well. And the actual amount of alcohol that is safe is actually quite low. But like for women, the amount of that's safe for breast cancer is only 3 standard drinks a week. So if women are drinking more than 3 standard drinks a week, they've got a significant increased risk of breast cancer. So I challenge people to reduce your alcohol. If you can, be alcohol free, or at least cut it in half. So a couple of other supplements that can be helpful is your magnesium for muscle cramps. Your coenzyme Q10 also can be helpful for muscle pain. And one other thing that I've been using a lot more of is B12 injections. I was always a little bit cautious, and I would sort of do, one a week for 2 weeks, and then two weeks, and then a month. But with Dr. Rosamund Vallings, she recommends doing 1 injection every week for 6 weeks to see if there's a clinical benefit, and then going to 3 monthly. And I've been doing that a lot more, and patients have found that very helpful. So B12 injections can be quite helpful. You will need to talk to your GP about that. So just to recap, the things that you can just start today is to be kind to yourself, up your water, eat lots of vegetables, and just challenge you with your coffee and your alcohol, challenge you with those things. A book that I found quite helpful, just looking at the whole chronic fatigue journey, is a book called Fibromyalgia and Chronic Fatigue Syndrome by Dr. Fred Fredberg. And I know that they have a copy of that at the Chronic Fatigue and Bay of Plenty, so I assume that other organisations would have a copy of that. And he talks about 7 steps in the recovery process, which in some ways supports a lot of the things that I've been talking about. So the first step is exercise, extended relaxation strategies. So how exercise is an important part to your recovery journey. And his second step is sleeping better, relaxing more. So again, there's the importance of sleep, and that whole relaxation, the whole thing with rest, and working out where are your deficits and how you can work with that. His third step is learning to pace all your activities. And that's really hard for chronic fatigue, because you just have got you've only got a limited amount of energy, you've got a limited capacity, and having to pace everything. So pacing is really, really important. And his fourth step is identifying and lessening anger. The whole thing with our emotions and with our thinking, and often there is a lot of anger because there's been a lot of loss in your life. So learning to identify that and deal with that is an important step in your recovery. And the fifth step is finding relief from worry, discouragement and grief. So again, dealing with those emotions and that thinking, and getting the right support, sometimes that means counselling, getting books that you find helpful and inspirational. The sixth step is easing into pleasant events and pleasurable feelings. Sometimes we forget when we're stuck, sometimes we forget how to enjoy things. So finding things that we enjoy, and that might be a little thing, that might be doing a little bit of gardening, it might be doing a little bit of painting. So it's important that we don't forget to enjoy things. And that also sort of connects a little bit with the rest and the creativity. Often our lives can shrink. They get smaller and smaller as we try to manage things. And so trying to expand our lives and making sure that we are doing things that fill us is really important. And his last step is getting support. So particularly with chronic fatigue, you have the chronic complex illness support group, and most areas in New Zealand have got access to it. And if there's no support group in your area, then there'll be maybe some phone calls. And they're an amazing organisation, and they've got workers, field workers, which go into people's homes and try and support. And they've also got amazing resources, because these guys, they're walking the talk, and they've been doing this for a long time, and they've got a lot of resources. So I just want to encourage you. It's a tough journey, but there is hope. And as I said at the beginning of my talk, that a lot of my patients have been able to improve their quality of life. They've been able to do meaningful things and often go back into the workforce. So, and I would just like to finish to go back to Te Whare Tapa Whā, and that whole, looking at it from a holistic point of view, the spiritual, the physical, our land, our family, our mental and emotional. And I just wish you all the best.